Hydrosalpinx. The normal fallopian tube is rarely seen on transvaginal ultrasound when the tube is filled with fluid. However, it is easily seen as filled fluid sausage-shaped structure with thin walls, incomplete septation, and a cogwheel appearance on cross-section. There is a lack of peristalsis, a feature that differentiates the elongated fluid-filled structure from the bowel. Furthermore, the hydrosalpinx, with its elongated sausage-shaped structure, tends to taper near its uterine origin. The presence of a tubular structure filled with clear fluid in the adnexal region should raise suspicions for hydrosalpinx, especially when a separate ovary is seen. This image showing the different tubule structures of anechoic and is a feature of hydrosalpinx. Tubo-ovarian abscess. A tubo-ovarian abscess occurs when an ascending infection involves the tube's ovary as a part of an acute process. When women are typically symptomatic with fever and pelvic pain and tenderness, but on occasion tubo-ovarian abscess may be silent. Sonographic characteristics of tubo-ovarian abscess are as follows. The first one is multilocular mass with thick walls, thick incomplete septal, fluid content is echogenic with grand glass appearance and involvement of the ovary. Peritoneal inclusion cysts. The peritoneal inclusion cysts are also referred to as cysts, which are cystic structure within the pelvis that entrap peritoneal fluid. These cysts primarily occur following surgery or infection and as a result from the pelvic adhesion that entraps fluid. Sonographic characteristics of peritoneal cyst inclusion are as follows. The first one is multiple primarily thick septations, separation attached to pelvic organ, fluid within the cyst is primarily clear. Normal looking ovaries can be occasionally seen. This image showing the ovary and peritoneal inclusion cyst surrounding the ovary and you see the uterus. These are the atypical image of peritoneal cystic inclusion. The next one is polycystic ovary. Polycystic ovary syndrome is a metabolic disorder that is characterized by menstrual disorder such as anovulation, hyperandrogenism, infertility, and the spectrum of metabolic abnormalities. The presence of the polycystic ovary, either unilateral or bilateral, is a part of polycystic ovarian syndrome. The morphologic criteria for the diagnosis of a polycystic ovary, most investigations have used a threshold of 12 follicles measuring 2 to 9 mm in diameter per ovary with increased stromal echogenicity. The image showing here is an image of polycystic ovary whereby we have 12 or more follicles within the ovary and they are measured, some are measured 2 mm to 9 mm per ovary. The next one is adnexal torsion. Sonographic characteristics of adnexal torsion are enlarged edematous adnexal mass, cystic area within the mass with varying degree of echogenicity, tender mass on probing with transvaginal transducer. These are the two images showing the ovarian torsion with solid mass, cystic and complex components within, while the left side showing complete echogenic mass of ovarian torsion.